Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to change an ostomy pouching system. In the previous video I did an NCLEX review over colostomies and ileostomies, so be sure to check out that video. So first, let's talk about the supplies you will need. You will need a pouching system. Here I have a one-piece pouching system, and it has a skin barrier, also called a wafer phalange, and it's attached to the pouch, so it comes together. Some people have the two-piece systems, and the skin barrier and the pouch are separate and they snap onto each other whenever you're placing the system. Also, what you may need that I don't have right here, you may need a barrier ring, and the barrier ring will go around the stoma for extra protection in case the patient's having a lot of skin breakdown from stool getting onto the skin and the skin barrier just isn't really protecting it. So the barrier ring would go around the stoma, and then you would set the skin barrier on top of that. And then also with this particular system, we have a clip, so be sure you get the clip if your patient needs one. Some bags will Velcro, and that's how they close, but this particular one uses a clip. Another thing you will need is a measuring card, and these come in the kits usually, and you will just be using it to measure the stoma because you will be cutting around your barrier what size the stoma is so you can apply it to the skin. So you'll need a pen. You will also need some ostomy scissors. These scissors are special in that they're curved and they have a blunt tip, so you can achieve a circular cut instead of a jagged cut onto the barrier. And of course you will need gloves. You will need some washcloths to clean the stoma and to dry it, and a towel just to prevent any leakage of stool onto the patient. First, perform hand hygiene, and then you will don gloves. Then get a towel and place that on your patient to protect their gown and their skin from any stool while you're changing the system. And some things you want to keep in mind while doing this: you'll want to change this system about every 3 to 5 days, and you will empty the pouch whenever it becomes 1/3 to halfway full. And here, as you can see, this definitely needs to be emptied, but we're changing the system, so it's good. And while you're doing this, you want to allow the patient to help you as much as possible because they need to become independent in doing this because they'll be doing it whenever they go home. Now, if you are a nurse who has a very sensitive nose and you're bothered by odorous smells, you need to be prepared for this because whenever you're changing an ostomy bag, there are some pungent odors. And to help with this, you can maybe wear a mask. I've even known some colleagues to put vapor rub around their nose before they go in to change the pouch to prevent the smell, and so you can have a menthol smell in your nose as you're changing it. So just be aware of that and prepare beforehand. So what we're going to do is we are going to remove the system, and whenever you do this, you want to do this when the gut is the least active because you don't want to be changing this and all this stool is just coming out on you because you're going to be making a huge mess. So usually in the morning before breakfast, before the patient eats, is the best time, or ask the patient because they'll know when their stoma puts out the least. But if this is a brand new stoma, they may not know. So what you're going to do is you're just gently going to remove the adhesive because this is the one-piece system and it has it's sticking to the skin. And if you have difficulty removing it, you can use some adhesive remover. Okay, so we have that off. And what you're going to do is just discard this appropriately. Then you're going to take your washcloth with warm water. Try not to use any soaps that have lotions, powders, creams, or any alcohol-containing products around the stoma or on the stoma because it causes some problems. And before you do it, you want to make sure you're looking around the stoma and looking for any skin breakdown like extreme redness. Now, as you can see in this example, there is redness around the stoma. This is not good. And what is happening is that stool is leaking probably under that skin barrier and getting onto the skin. So whenever you're replacing the pouching system, you may want to use a barrier ring and make sure that you're cutting the skin barrier to fit the stoma appropriately so it's not leaking onto the skin. And what you'll do is you'll start around the skin and just gently clean the skin, making sure to get any residue off. And then you will clean your stoma. And the stoma is not painful to the patient. Remember, it's just the inside of the intestines flipped inside out. So it's not painful for you to clean the stoma. And make sure you have it all clean. Then you will pat the area dry. You want this to be very dry because if it's not dry, your skin barrier is not going to stick to the skin. And if you have a patient who has a lot of hair on the abdomen, because you know hair grows back, you may want to trim the hair because number one, it'll stick better, and when you remove next pouch change, it's not going to wax their hair off, which can be very painful. So make sure you do that. Then discard your gloves and perform hand hygiene and put on a new pair of gloves. Now we're going to measure our stoma using our measuring card. And the reason we want to do this is because we're going to be cutting a hole on our skin barrier. And this is going to be going on the skin, and we don't want to cut it too big where stool will leak onto the skin, or cut it too small where it will constrict the stoma. So we want to measure appropriately. And you'll take your measuring card and you'll put it flush up against the skin, and you want about a 1/8 inch area around the stoma. So this right here, way too big. That is too big as well. Let's try this one. And that one looks like it's perfect. You have around the stoma about a 1/8 inch. And look and see what it reads, and it says 45 millimeters. So we're going to match that up on our bag and trace it. Now, some skin barriers are already labeled and they have a nice little outline of where your measurement is. Like here, it already says 45 millimeters, so I don't have to trace it. But sometimes skin barriers don't have that. So what you would have to do is put your measuring card over it and trace where you had your measurement. So you would find the 45 millimeter and you would just create a circle on the barrier and then cut it out. Now I'm going to take my ostomy scissors and I'm going to cut around the 45 millimeter mark. And just go back through and make sure everything's nice and round and there's no jagged edges, because you don't want this to wear on the stoma or on the patient's skin. And we have it and looks good. Now let's put the new pouching system on. What I like to do is I like to snap my bag and make sure it's closed before I put it on, just in case something leaks out. So this is the clip. Like I said at the beginning, some Velcro. These clips can be a little bit cumbersome to use, so get familiar with how to use them. What you do is you take the end of it, the bag, and you just simply fold it over the clip like so. And then you just press that down and it snaps in place. And you have your little clip on. And then you will take the backing off of your skin barrier. And if you're going to place a barrier ring, now would be the time to do that. So you place the barrier ring around the stoma, and then you would place your skin barrier, your wafer flange, on over the stoma. And you want to make sure that it fits really good and that you smooth it around the stoma so it's sticking to the skin appropriately. And feels very good. Now, some things you want to keep in mind. If this is a new ostomy for the patient, you want to explain to them that they need to be checking their bag ever so often because it can inflate with gas, and they will need to do what's called burping their bag. And to burp this particular bag, you would take off this clip and just let the air out. Now, some ostomy bags do have a filter that allows the gas to escape and prevents an odorous smell from coming out. So you just have to look to see what you have and just warn the patient that and when they do relieve the gas from their bag, that they may want to make sure that no one's around if someone's visiting them or something like that, because it can produce an odorous smell. And as the nurse, you want to be checking this as well, because our patients tend to wear those big bulky gowns, and they can occlude you being able to see if the bag's inflated. So you'll have to pull the gown back and actually look at the bag. So that is how you change an ostomy pouching system. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
This video will review the characteristics of barrier accessories for ostomy pouching systems. Barrier accessories come in a broad range of formulations. There are tube pastes, there are strip pastes, there are rings, and there are sheets. There are a variety of properties that should be considered when you select these products for your patients. The properties to think about include the pliability or their flexibility, the amount of erosion resistance or moisture absorption, the ease of use and their ability to dose correctly, the presence of alcohol in the product, and their relative cost. We're going to review the commonly available barrier accessories, looking at individual merits and concerns. It's important to note that there's no universal language for describing or grading barrier accessories. Most descriptors come from clinician experience. So the very first one that we're going to talk about are the tube pastes, and all of the companies have a paste that comes in tube format. They're all somewhat misnamed in that they're called a paste, and that implies that they're actually glue, or that they're adding an additional glue, when in fact these are more like a filler. They're caulking, and they're a place to fill in a gap or a crease. So if you have a patient like this who actually has a crease on either side, and you were to use something like a tube paste, I'm just going to show you when we dose it out here. Is that you've actually got a very soft and pliable product here. This has got no rigidity to it whatsoever, so it has a lot of flexibility to it. It has a moderate amount of moisture absorption. All of the barriers actually have similar formulations, and they all have properties or ingredients in them that actually allow for the absorption of moisture. And there is a certain amount of I guess, what's the best term? Probably that they would puff up or absorb the moisture, but they also will wash away and erode. So if we go back to this particular example here, if you think that you're wanting to fill in the crease here, okay, is that you have to think again about what happens with that patient if they change position, right? And if you've got a soft pliable paste in there, is that it may not actually prevent the erosion that you're looking for. So you might want to be looking for an alternate. When you're typically using a paste, is that you want to make sure that there's a good bead. We're using this usually to fill in the gap with the traditional barriers. When you size the barrier opening, is that it's usually about 1/8 of an inch or 3 or 4 millimeters larger than the base of the stoma itself. And for that exposed skin, we're typically wanting to protect that with some sort of a barrier accessory. So if you were going to apply that on the back of this, is that you would want to apply a very good bead of paste all the way around that opening like this. Okay. And once you've done that, is that you would then apply it over top, and you should actually see the paste bubble up over top of the stoma. And you don't want to wipe that away. You want to leave it in place because it's actually going to provide a good seal. Remembering that this is not actually glue, this is not adding adhesive onto the back, it's a filler or a caulking. All of the barrier, or all of the toothpaste rather, have got alcohol in them, so that if you do have broken skin, they can cause temporary burning or discomfort. There is one paste that's available that has no alcohol in it, and that is, or from a toothpaste perspective, and that is Econ paste, and that's not easily or readily available to us here. So again, if you were to use something like that, you would probably not obtain the erosion resistance that you're looking for, or the resistance to the stool that you're looking for. In general, toothpastes are not recommended for individuals with a urostomy, but they're used for individuals with a ileostomy, and depending on the consistency of a stool for a colostomy, you may or may not use it. The next grouping is strip paste, and probably the most commonly known is this one from Coloplast. Hollister also has a strip paste. I don't actually have an example of it here, but it has an awful lot of what we call memory to it, meaning that when you distort it or you play with it, is that it actually wants to go back into the shape that it originally started out being. This one from Coloplast is a little bit different. So this has no alcohol in it whatsoever, and you can dose as much as you require for that particular use. So it may be that you actually want to tear off a little piece to be able to put into the crease or the fold, or you want to use a portion of it to be able to turn it into a circle so that you can use it in place of toothpaste. And because it has no alcohol, of course, it's not going to cause any discomfort to the patient. So if you want to dose it, you would actually just pull off a portion of it like this. And as I said, you could do a couple of things. You could roll it in between your hands like this. You could fill in your crease on either side, and you could take off a portion and fill in your crease on either side, and then continue on with your regular pouching. If you wanted to use it for a in place of toothpaste, again, you would roll it in between your hands like this. I always say to the patients, you're going to turn it into a sausage. You're going to take your sausage and you're going to turn it into a donut. And then you would put the donut on the back of your barrier. So you would peel this off. And as I said, my preference is to actually put it on the back of the barrier like this. Make sure that it's attached, and then you would apply that directly over top of your stoma and put your hand over top to warm it up. So there's a lot of flexibility. As I said, with the strip paste, it doesn't have any alcohol. It has a moderate amount of, moderate to good amount of erosion resistance. Again, that is really somewhat clinician biased and based on experience. And it will absorb some moisture and actually puff up around the stoma when in contact with the moisture from the effluent. The one thing that I did talk about, forgot to talk about, was the amount of dosing that you can get out of a typical tube. You can usually get, patient would probably get about a 2-month use out of this, and most tube pastes are probably in the range of about $17 to $22 for a single tube. Strip paste, as I said, you can, depending on how you're utilizing it, how large the stoma is, you can either get a single use out of it, or you can get multiple doses out of it depending on your utilization. And these are a tad over $3 each. So again, may be cost effective depending on what your utilization is for that particular individual. The next grouping are rings, and that's probably the largest grouping out of all of them, and they have a broad range of formulation, I shouldn't say formulations, probably shapes and sizes that are available to you. And again, they don't have any alcohol in them, and they come pre-formed. The most commonly used or your recognized ones are these round ones, although what we're starting to see now is that they actually come in what we call a regular thickness, and then these are called the slims, and a couple of the companies have now got availability in a slim version. Econ and Coloplast have thin versions of it. So again, there is a lot of flexibility associated with the utilization of these rings. There's tack on both sides, so there's no right or wrong to it, and these have no memory to them, so that when you actually stretch it out into the shape and size that you want, is that it will actually stay there. It's not going to want to pull back into the original shape that it started out with. One thing you do have to take note of is the more you stretch, is that you actually make it thinner. Okay, so you have to think about what it is that you're wanting to utilize it for. But if you have an oval shaped soma, is that you can actually stretch it out to the oval shape. But if you have a round shape, is that you can actually, again, put that over top of the stoma. The one thing with all of these barrier accessories is that they have no plastic shield or covering that actually helps to support it like you would see with a barrier. So that means that these can actually touch the stoma, and you're not going to be concerned about laceration or any kind of damage to the stoma itself. There are other rings that are available, and these ones are from Hollister. These are their convex barrier rings, and these are the only ones that are available. All barrier rings will actually add some degree of convexity, but these are far more pronounced. As you can see, that from the side, or the shape is that you've got quite an elevation and you've got a tapered edge. They originally came out as this shape right here, which is the round one, and they have 3 different sizes. And when you manipulate these ones, you're going to notice quite a bit of difference from the other barriers in that they have a lot of memory. So when we stretch it out to that shape, it doesn't take very long, and it wants to actually go back to its original shape. So that can be a little bit of a challenge when you're trying to teach somebody in terms of actually manipulating it. So that if they have their barrier and they're wanting to put it on the back of a flange, is that you really have to be quite careful and quick that you actually stretch it out and place it onto the back of the flange at the same time. And that may be a little bit more of a skill set than somebody feels comfortable doing. Okay, but it does add, as I said, a fair amount of convexity on the back of a flange. So if you're not getting enough convexity with the flange that you've pulled off the shelf, it may be by stacking this on top of it is that you'll actually achieve the convexity that you're looking for. These are extended wear barriers, so they absorb an awful lot of moisture, and things to be consider is that they, in contact with the skin, if you're getting an extended wear or long wear time, is that you may see a little bit of maceration, or the openings may be actually too tiny and they will swell up and actually occlude the opening. So be careful of that with your smaller stomas. These convex barrier rings now come in an oval shape. And again, the same idea is that you can distort it and stretch it out into various shapes, but you're going to see that it wants to actually go back into the shape that it originally came out of the package. It does have these little, I'm not sure if you can notice that there's these little tapered edges top and bottom. So these are actually quite good for individuals that have fistulas or heavily draining wounds, and you're wanting to pouch that over top, and those little notches fit in there quite nicely. Barrier rings also come as in larger sizes like this. Okay, and again, it's the same idea, is that it's just a larger version of the smaller ones that we saw earlier, is that you would actually want to stretch that out into the shape. They're fairly thin. They're probably closer to a slim version of the smaller rings than they are the thicker ones. But if you have a large area of open skin on the surrounding area, or some people use this as an interface between their pouching system and their skin, is that this is an option as well. All of the barrier rings are relatively or comparatively expensive when you think about the range of prices that you see here. And the rings will start anywhere from about $6 for a smaller ring like this. And when you start getting into the larger rings or to the oval rings, you're starting to get closer to $9, $10, $11 for them. Lastly, we have barrier sheets. These come in a variety of sizes as well. So you may have a sheet that, like this one, this is an Econ sheet that comes obviously rather elongated, and you can actually cut this up or dose it into smaller pieces, or you can utilize it as a whole sheet depending on what your purpose is. We have extraordinarily large sheets like this one, and again, multiple doses, or use it as a whole. And then you can get smaller sheets like this one that are probably about the footprint size of whatever pouching system that you're utilizing. So these have a place in ostomy care. Again, is that if you want to utilize it as an interface between your existing pouching system and the skin, is that something that can be utilized to apply over top. If you have somebody like this who has mucocutaneous separation and you're utilizing a powder to fill that in, and you want to be able to secure the powder, I'm going to just move that over like that, is that the barrier sheet can actually be used to hold the powder in place without having to worry about toothpaste causing burning or discomfort because of the alcohol associated with it. You can, as I said, you can take little strips of this. I'm actually going to cut a little piece off here. And depending on what you want to do, as I did with that other sheet, you can either cut a hole in the center to match your stoma and use it as that interface, or you can take those little pieces and again use that to actually fill in any creases that you may have. You can actually roll and manipulate that so that it fills into the crease. Okay. On the range of cost, probably in the sheet can be anywhere from about $6 to about $12. Again, depending on the dosing or how you're utilizing it, it may be cost effective or it may be an expensive portion of their care. A couple of newer options, and as far as barriers go, there are these flange extenders, and these go on the outside of a barrier. So if you've got somebody like this who feels that they need to have their barrier extended, is that you would actually take this extended or this half moon shape that's pre-formed for you, and you would apply it to the outside of the barrier like this. It may require 2 or 3 depending on the size of the barrier to go around, and these are probably running in around $1 to $1.25 each. And there's a hydrocolloid as a strip, so again that you have multiple places where you can actually dose it, and this may be good for using over a little area that might be ulcerated, and you're using it to secure a dressing over top of that peristomal ulcer. Actually even good for peri-wound skin protection. Just going to go back really briefly to this, is that the utilization, as I said, of a barrier ring may be that you want to actually fill in curves and gullies. So if you can look at this from the side, is that you can see that the stoma is actually within a gully, that it's under tension, and that you have a flush stoma. So you're looking for some degree of convexity to want to be able to fill that in and compensate for this so that you don't actually have a leak. And that's where a ring may be sufficient for you. So you might actually be able to stretch that out. As I said, it's okay for it to fill the stoma, or to touch the stoma. But if you see how that fills in the shape, then you're going to start to understand or appreciate whether or not you actually have enough convexity, and whether you've distorted those body contours sufficiently to get a seal. So probably that slim is insufficient. But if we were to take this, the convex barrier ring, and fill that into the shape like that before we would put our barrier on, you can start to see that you're actually getting closer. You would need the smaller size, but you could actually see that you're getting into filling in those dips and gaps a little bit better, so that you would be looking for a deeper convexity. If you require more information about paste, strips, rings, and sheets, contact Joe or the customer service lines for the major suppliers in Canada.